I would like to present on behalf of Myanmar Group. I would like to present some weakness and strength. What we learned from this meeting by SWOT analysis. First, our country, most of our country, MBDS and IPA, we have one health system. We are doing one health system, but we are weak. Therefore, we need to strengthen one health. Another second point, we are sharing information between countries, but we need to strengthen sharing information between countries. Nowadays, we are threatened by the new emerging disease. Our opportunity by the media is we can understand the various surveillance system of another country, and near future we hope we will build strong cross-border collaboration and coordination between countries among MBDS and IPA. Thank you.
I want to share what I learned from this workshop. The first is about how the importance of multi-sectoral working team. I mean, in Indonesia, we have already set up for national committee and structure that work together in multi-sectoral partner, but it's not easy as planned. So from this workshop, I learned how we can make it more effective work or strengthening the multi-sectoral work, and how we should really put empathy for the other aspect or impact outside the disease. Because if we came from animal health or human health, we sometimes only based on the scientific evidence, but sometimes forget that other aspect is very important to consider, like the economic and then politics and then maybe religion or ethnic in some sensitive ways. And then I learned also that the regular sharing information in country, intersectoral, and also in each department is very important, and also like this in regional level is also very important, but it should be in routine condition also, not only on outbreak. So the second part, that what the three list priorities I want to do differently in my country. This is quite different because I'm based in the non-government organization, but I will make it sure that for the next session, the representatives of Ministry of Agriculture can also join with us. And this is for my perspective, because as I said, that we have already some structure take in place. So what I want to do differently is to make to optimize the multi-sectoral work. So this is including doing on the action plan, set up for the action plan for the contingency plan, because in Indonesia we have already suspected MERS-CoV, suspected Ebola. We have a country with many culture and many diseases come actually, and we learn from avian influenza, from rabies. Yes, this multi-sector is already taking place, but not really optimized in the work. So what I want to do different is work closely, more engaged with each sectoral related with the plan, and also how they can support the commitment included in the from national until local level, to provide also own support fund in the local level also, because we are in the autonomy area in each province quite different. So in the national level also, so we have the leadership to take the outbreak or the routine situation, and also the local governments also involved in the commitment. And the second way is I want to also recommend to strengthening on the early detection system, because many cases like now new emerging diseases like Ebola or MERS-CoV, we already have suspected from on human, but fortunately it is negative. But we have many population that have high risk, like Indonesia have many population on bats. We have many cave with fruit bats. We have many population on orangutans, primates, and then it should be a strengthening in the animal health set for early detection, for doing some surveillance in that population. Some also will import also some animal for laboratory tests a necessity. So it should be also doing some plan to set up for the early detection if disease come from this population. And the third one is I want to do differently in the developing how we develop the network system information, because sometimes the working system is only in the national level, in only involve some multi-sectoral, but most in the government. So in Indonesia we have many NGO that work closely with the community, but usually they work also only for the poverty, like facilitating on infrastructure, loan money for the economic for poverty in community. But actually we also engage with the private to support in the health issues like this, how to work with community and share the information about the importance of the disease. And because we are a very multicultural country, in the system of network information, I want also working closely with the traditional leader or traditional community, because we have like organization that sustaining the local tradition, that this is have different role with the government tradition. Sometimes is government say A because they already developed some regulation, is not will not given any impact to the traditional community. So we must make the harmonization about the traditional regulation with the national regulation to connect about this issue, because the traditional population also live usually closely with the high-risk population, live in the forest, live closely with the primate, with the bats, like that. So I want also involve in this network consisting information is much work with the universities, with education and institution, because usually very effective way is when we can share the information through the formal institution, like education, like in the school, in the university, to put this issue about the zoonotic diseases as one thematic. In Indonesia now we have new system in the education that more about thematic situation, about the environment, about the kind of like issue about the corruption. So we can put this idea about how we can raise awareness in the education community about these diseases. And the last one, I think is still related with the strengthening on early detection and optimizing multi-sectoral work, is how we can also increasing our capacity building in the laboratory testing, in the human source capability to detect disease, mostly in the government or officer, because they are the people that they have power to give recommendation to higher level. I think it's enough. Thank you.
We come from different country and different sector and different level. Maybe we we will have a discussion 3 days, and we get the 3 experience, bachelor experience, and I think need improve in our country 3 problem. First, I think about the human health and animal health, the cooperation. In China, we walking to the human health, the people is very so many people walking to the human house, but for the animal house is a few person. Like every county have CDC, but no animal CDC. I think we need to change this problem. Second, about the risk communication. Past the time in China, risk communication just the government the business, not about the CDC or other sector. And I think we need to improve this about this problem. The third, I saw about the media. When the disease happened in China, usually just contract the CDC. No, the media no contract the media, and many information not open. Just cover the government. I think this need to improve. Let the people know everything, and better prevention disease. Yes, it is better.
I fully agree with Dr. Lee about the points on the risk communication and media. I worked in China from 2004 to 2012, so 8 years in China. So I also experienced the change in the concept of perceptions of the Chinese CDC and government. At the beginning, we always talk like, what should we keep to avoid the panic or confusion of the public? And now we also the concept is changing. It's like, what should we tell and how to make the public less panic and less confusion? Yeah, I think we from the change was triggered by SARS, and then H5N1, and now MERS-CoV and Ebola. I think the public health and One Health concept is keep on evolving and getting stronger and stronger.